A crown is something that we use to protect your tooth to make it stronger. It's made typically out of ceramic and looks very tooth-like and natural. And in order to put that over top of your tooth, we have to change the shape of your existing tooth to allow a ceramic to go over top. So kind of like a top hat that would fit over top of your tooth. Same-day crown is such an amazing procedure. We use a technology called Cerec, and it has been around for over 30 years now. It's an absolutely incredible technology that allows us to give you a crown in one visit. You're usually in the office for about an hour and a half, and the huge benefit is that traditionally we would have to do what we call a temporary crown that you would wear for about 2 weeks and come back in to have your final crown cemented. Because we're not using a lab and we're doing it in our own office, we're able to provide you this crown within that hour and a half. No, we actually charge the exact same amount for an in-office crown as we do for one that we need to send out to the lab. Yeah, you definitely can. It's a bit of a longer procedure, but we can do both of those procedures at the office in one appointment. No, crowns aren't painful at all. Definitely some people have some different things going on where they can experience some sensitivities, but we're always really good at preparing you to know what you're going to be dealing with in terms of sensitivities potentially after or not, depending on how you present when you come to the office for that visit. Yeah, they can definitely be removed. But if you're removing this crown, it is now destroyed. So a new one would have to be remade. Yeah, definitely. And often people actually report that they're eating better because if you're getting a crown in the first place, it's probably because something was broken down and not actually doing the job it could potentially be doing for you. So this crown is built up to the proper anatomy and function that a tooth should actually have. If you're having that type of a symptom, there's definitely something going on that shouldn't be. A typical reason for that would be that the crown is breaking down at the margin for some reason, most likely that there's a cavity forming in there, or maybe it's even started to get loose and bacteria is seeping underneath, creating the bad smell. So definitely visit your dentist if you are noticing this. If that has ever happened, please go see your dentist. If the tooth is black underneath, it means that there isn't a proper seal and bacteria is getting in there, creating a discoloration of the tooth. There is one other reason this can happen that we'll see. Sometimes when a tooth has had a root canal, it gets discolored and it kind of has a grayish hue to it, and it actually isn't a problem. It's just a color change that's happened from all the trauma that's happened to that tooth.